What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for November 19, 2020. Kaiser's Chief Health Officer Dr. BECHARA CHOUCAIR on COVID-19 response. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Dr. BECHARA CHOUCAIR, the Senior Vice President and Chief Health Officer of Kaiser Permanente. We speak about how the Kaiser health system has responded to COVID, including through innovative partnerships with public health agencies and a focus on addressing social needs. Let's listen. Dr. CHOUCAIR, thank you so much for joining me to talk about Kaiser's work on the pandemic. Give me a sense of the scale of the number of patients that Kaiser is responsible for.
Well, thank you so much, Josh, for having me join your podcast here today. So Kaiser Permanente, as you know, is the largest not-for-profit integrated health system in the country. Every day, 12.4 million members trust us with their care and coverage, and we operate in 8 states in Washington, D.C., and over 200,000 Kaiser Permanente colleagues and over 22,000 physicians take care of those 12.4 million members.
So the pandemic is not a small matter for you.
Absolutely not.
So tell me about the response within Kaiser. I'm particularly interested what you do when you find out that one of your patients has COVID-19.
Well, one of the things that we've learned early on, Josh, in engaging with our members who are testing positive is many of those members were catching the virus from the household, and many of those members were passing the virus to their household. So we really realized early on that we have to pay attention to household transmission. What can we do to prevent the cycle of household transmission has been a key part of our pandemic suppression strategies, if you want.
Now, in general, most doctors might think, well, I'm responsible for my patient, not necessarily for what else happens in the household. That's for public health. So how did you, sounds like you're thinking differently about it.
Well, for us, it's a no-brainer that we're in the midst of a pandemic, and we had to think about what role can we play to help suppress the pandemic? How can we support public health to suppress the pandemic? And we knew household prevention is a key strategy to do that. And the other thing to keep in mind is, if you're a member of a household and you're a Kaiser Permanente member, chances are your household are also Kaiser Permanente members. So it became really critical for us to think about the household as a unit. And that's why right now, the moment you're a Kaiser Permanente member and you're diagnosed with COVID, you have the option to engage with our household prevention effort that has 3 key components that help prevent that transmission.
Tell me about those components.
So the first component is really around coaching and counseling. And really, it's about providing our members with the tools that they need to make sure that they're isolating or quarantining at home safely. So the moment you're a member who's diagnosed COVID positive, you have the option to engage with a coach or a counselor to help you navigate what would it take to isolate safely at home, and whether you have the possibility to isolate safely at home, dependent on how big your household is, how many people live there, how many bedrooms you have, how many bathrooms you have. So the coaching is a key component of this effort. The second big part of this effort is we actually, the moment we know you're diagnosed positive, we have a package that we send to your home that include all the items that you would need in that kit to be able to isolate safely. So it includes.
Let me guess. You have masks?
We have masks.
You have hand sanitizer?
Hand sanitizers. We also have paper plates. Exactly.
Okay.
Paper plates. And many other tools. And we have education materials so that our members and their household can feel comfortable in learning how to isolate and quarantine safely. So that's the second big part of the effort. The third big part of that effort is really around making sure that we're meeting our members' social needs. And we'll probably come to talk a little bit about that a little bit later in the podcast. But it's really important that if we're identifying members who can't isolate safely because they have food insecurity, because they have housing instability issues, there might be some other social needs that are preventing them from isolating safely, then we can connect them to resources to be able to help them meet those needs. And we've stood up call centers that are dedicated to support our members' social need throughout this effort.
Right. It doesn't matter how much hand sanitizer you're sending someone if they don't have enough to eat.
Absolutely. And it doesn't matter, how much you can counsel someone to stay at home within 2 weeks if you don't have income for those 2 weeks to be able to pay your bills. So, those are the things that are bubbling up day in and day out.
Now, I've heard that you are also developing some partnerships with public health, going even beyond what you're talking about to support the contact tracing effort. Can you tell me a little bit more about that?
Absolutely. Early on, we've also realized that there's no one magic bullet to help us deal with the pandemic and suppress the pandemic. We need to do a lot of things and do a lot of these things well. And one key strategy that we have in our toolbox as a country or as a public health discipline is the ability to provide contact tracing. And we know for generations, this has been for over 100 years, this has been a core public health function that we have used effectively for years and years and years. So when the pandemic hit, we realized that now we need to be thinking about contact tracing and taking it to a whole different scale. And we knew that we could have a role to play to support local health departments or state health departments in the whole construct of contact tracing. So earlier this year, our board of directors approved $63 million to help local health departments in partnering with the state, supporting and augmenting contact tracing effort in our footprint, particularly in California. And we're really excited about this effort. We've partnered with the Public Health Institute as a third party that's actually creating the link between the healthcare delivery system, local health departments, and the state. And what we're doing is we're creating 50 micro teams that we're going to be embedding in clinical settings within the safety net, public hospitals, but also within Kaiser Permanente facilities to be able to augment and support the contact tracing efforts that local health departments will be doing when patients test positive.
I imagine potentially that one of the benefits is speed, right? As soon as you get the diagnosis clinically, you're then able to start the process of contact tracing in coordination with the county, rather than have the test go over to the county, have a contact tracer assigned. But at the moment of the diagnosis, you can get started. Is that a potential advantage?
Absolutely. This is the key advantage that we're able to bring in those micro teams. When you have those micro teams embedded in care delivery settings, the moment someone tests positive, and if you have the right connections with the local health department, you could start that process. And we all know how much time is of an essence when it comes to be able to stop the spread when you have someone who's diagnosed positive.
Right. To be successful, though, the people who are doing the contact tracing, making those calls, really have to be able to reach, talk to, and relate to the contacts. How are you thinking about that challenge?
You are absolutely right. And that's why the engagement with the local health department and the contact tracing, the formal contact tracing efforts that local health departments lead is so critical. And the way we're thinking about the micro teams is we wanted to make sure that those micro teams have people who represent the community. And that's, I think, is a key advantage that in our partnership with the Public Health Institute, we already have 4 micro teams up and running. Each micro team has about 10 folks who are working and supporting and augmenting the contact tracing efforts that are happening at a local level. And in the first cohort, 67% of the team members are Latinx folks, and they're bilingual. And when you think about the counties where we're starting to do this work, in San Bernardino County and Southern California, this is how the community looks like. So to make sure that these micro teams look like, speak like, represent the community, I think is an integral part of why we think this model is so helpful and will be very successful.
I'd like to dig a little deeper into the health disparities of COVID-19, including the enormously high rates of illness, hospitalization, and death among African Americans and Latinx persons. I know that health equity has been a major focus of your career. What is Kaiser doing to address these disparities?
Well, let me first just start by saying that what we've seen with the pandemic is just truly a tragedy when it comes to the disproportionate impact of this pandemic on people of color. The reality is the pandemic didn't create the inequities. The pandemic just put these inequities into just a really right front and center to what we're seeing across the country. And there are 2 big buckets of work, I think, that I'd like to just touch on here briefly. One, we truly believe that there is a need for a targeted messaging that reaches the communities that are most impacted by the pandemic. And we have invested, and we are investing over $8 million that the board of directors has just approved to partnering with influencers in the Black community, in the Latinx community, to really be able to deliver messages that are trusted from trusted voices, trusted people, along the issues of the importance of masking, social distancing, hand washing, getting the flu vaccine, being ready for the COVID vaccine. All those are important elements that we are seeing again and again, that it's really important that the message that's getting out to the community is a trusted message from a trusted messenger. So we're really excited about partnering on that.
Really, public health communication 101, making sure that that's reaching every community.
Absolutely. And that's why we're partnering with 2 ad agencies that are owned by people of color. They're doing focus groups. They're helping develop the message. And what I'm mostly excited about is the identification of influencers and engaging influencers in those community to delivering the message. And we have a couple of dozens of CBOs that will be working with us to help deliver that message as well through their channel.
Community-based organizations.
Exactly, community-based organizations. So that's one aspect of our work. The second aspect of the work that we've realized is really around meeting the social health needs of our members. And before the pandemic hit, Josh, we commissioned a national survey of a representative sample of people living in this country from multiple geographies, multiple demographics. And what we've learned in that survey is that 67% of people living in this country have had at least one unmet social needs in the prior year before the survey. So we've asked about food, housing, transportation, social isolation, the ability to pay your bills. 67% of people living in this country have had at least one unmet social need. And when we pushed even further, 1 in 4 people have had an unmet social need that was a barrier to health. So think about that for a moment. 1 in 4 people living in this country have had to make a decision between, do I pay my rent this month, or do I pay my copay to get my medication? Do I buy food to put at my dinner table, or do I pay my co-insurance to get the surgery that I absolutely need? And you and I know when food and rent are competing with health, we know what gets covered first. It's really the food and the rent. So social needs have been, in this country, have been a significant barrier to health for years. And what we've seen with the pandemic, it actually accelerated the surge of these needs and the importance of addressing those needs. So as a health system, we've accelerated our process to be able to screen our members for social need and be able to meet those needs through what we call our flagship effort that we call Thrive Local to help support our members, which has multiple factors in it as well.
So there's only one Kaiser. And I guess my question for you is, what do you think the rest of the country can learn from these intense efforts that you've been working so hard on the last few months?
Well, for me, I think it becomes so clear for someone like me who's a family physician, spent most of my career in clinical settings, had the opportunity to spend 5 years running the health department in Chicago and be at the core of public health. For me, I think what we're seeing today more than ever, that the healthcare system and the public health system, they really need to come a lot closer together. And we complement each other, we work with each other, because at the end of the day, it's all about creating better opportunities for people to live healthier lives. And I would, for me, over the last 8 months during this pandemic and the last 4 years at Kaiser Permanente, creating those bridges and aligning much closer to the public health community is an integral part of what's going to be our way to get out of this pandemic. And I would encourage other health providers to align even more and more with their public health agencies and the public health infrastructure for us to be able to create a better future to get us out of this pandemic, but most importantly, to get us set for a future that's really a healthier future down the line.
Great. Well, incredibly well said. Thank you so much for joining me.
Thank you so much, Josh, for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.